All right, a very good evening to fellow viewers that are watching from home. Some of you are watching on your commute and some of you are watching from your workplace. Once again, this is Hugo Tan here. I'm from Roadtrack 1 ASEAN. And tonight we have a very special guest for a very critical topic of our times. And if you're watching this, I would like to encourage you to click the popcorn button where you can start a watch party to share this with your friends and family. Because tonight, we are going to tackle the silent killer in the Southeast Asian region, which is the topic on mental wellness. Currently, most of our countries in the region are still in some form of quarantine or social distancing. Unemployment is sky high, businesses are disrupted, and lives would not resume to normal anytime soon. And at the same time, the crisis of mental health is being overlooked day after day, year after year. So the topic that we are going to have for tonight is actually to dissect and to dive into the mental health outlook of Southeast Asia. What is it like from the political, economical, and social, cultural perspective? With this, our special guest for tonight is a Filipino activist, a nurse, a medical doctor, a mental health advocate, who is the founder and national chairperson of the Youth for Mental Health Coalition, and a member of the technical working group of the Department of Health Strategic Plan for Mental Health. He will be discussing all these different social determinants of health and how different people, different demographics, facing different unique realities, and they have different needs that need to be understood and approached very differently. With this, let us all put our hands together for Dr. Raymond John Naguit.
Hello. Hi,
welcome.
And good evening to everyone who's watching via Facebook Live. And I'm really looking forward to have a very fruitful discussion with everyone today. So if you have questions later on, you can put them on the chat so that Hugo can read them to me later.
Exactly. So, yeah, I'm seeing some comments coming in. This is a good start. So once again, before we begin, this is such an important topic. You could be having your dinner, you could be at your work, but what you can do right now to help us to forward this cause to more of your friends and family is click the popcorn button and start a watch party. So that while you're watching, your friends and family can join in and give their commentaries. So at any time, if you have any questions, feel free to write in the comment section. And after Dr. Naguit's presentation, we will pick them up for Doctor to address. So with this, Dr. Naguit, how was your day?
It's good. It's quite busy, but I'm really excited to be with you tonight.
I see. Perhaps you can share with us a bit as more of our viewers are coming in. How long have you been in the activism for mental health? And what drives you? What kickstarted this movement? Dr. Naguit?
Actually, if you would talk about advocacy work, I always defined it as an external expression to personal pains and inconveniences. So it's actually stemming from a personal experience when I had to deal with someone who attempted suicide as well as someone who has completed suicide. And later on, we actually formed a coalition to lobby for a mental health law in the Philippines. Actually, the bill for mental health was actually 20 years in Congress before it actually passed into law 2 years ago. So right now, we're still helping the Department of Health in terms of implementing these policies and the programs.
Interesting. So I think we have a sizable amount of viewers right now. Perhaps we can start the special presentation by Dr. Naguit. Are you ready, Doctor?
Yes. Let me just share my screen.
Sure.
Okay.
So while Dr. Naguit is sharing his screen, remember to give us a thumbs up if you are following us. Say a hello so that Dr. Naguit knows you are here with us tonight.
All right. So can you see my slides already?
Yes. Let me add them to the screen.
Great. So good evening, everyone. So I'm Dr. RJ Naguit. I'm from the Youth for Mental Health Coalition. We're a non-government organization based in the Philippines. And basically what we do are three things. The first thing is that we try to influence policy at the national level as well as in workplaces, in schools. We also try to conduct several mental health awareness talks ranging from wellness, from suicide prevention to mental health in the community. And then we also try to facilitate service delivery in the community level. So we try to address specifically the mental health of young people. And today I was actually asked to talk about the social determinants when we talk about mental health. But of course, we have to understand that in a time of pandemic, most of the imbalances are actually very much amplified. So we see a lot of inequities in terms of health, human resource, in terms of government support, as well as some concerns that might arise because of the pandemic itself. So one issue that we're actually trying to address right now are the social injustices that are experienced by different people across the different sectors that we're engaged with. So my talk today would actually focus on the intersectionality of social justice as well as mental health. So just some disclaimers before I start my presentation. First of all, I'm not a psychiatrist or a psychologist. I'm a medical doctor by profession, but of course, I recognize that I'm not yet a specialist when it comes to mental health, but my work right now deals with a lot more of public health as well as engagement with various sectors. Of course, when we talk about mental health, we might be talking about very sensitive things, such as the topics of suicide as well as depression might be brought up. That's why trigger warning for those who might be experiencing some form of distress. And if you feel uncomfortable at any part of the talk, then it's okay to pause the video for a bit or even reach out to the organizer so that we can map out ways on how to provide support to you, especially if you're based in the Philippines. And of course, this presentation is an attempt to start a discourse. And of course, it's very important that we also recognize the different perspectives when we talk about this very important issue. And of course, you might actually want to read up more on the intersectionality of mental health because this is a very broad topic, and this is my humble attempt to summarize what are the things that I think are important for us to understand as young mental health advocates. So this will be the flow of my presentation today. So first, we'll be looking at the overview of mental health in Southeast Asia in the time of pandemic. And we will be mentioning what are the different factors that can affect the mental health of young people, especially in these times. And then we will look at the historical perspectives as well as the critiques on psychiatry and even the discipline of psychology. And then later on, we will be mapping out some steps in terms of addressing the intersectionality of mental health as well as social justice. So this slide, this is actually based from our World in Data in 2017. And this is the map of Asia. And as you can see, it has colors. And as you can see here, the darker the color is, the higher the prevalence of substance abuse and other mental health conditions in that specific area. So basing from this slide, the ones who are in the western part of Asia seems to be having higher rates of mental health conditions compared to us in the Southeast Asian region. So usually the countries in the Southeast Asian region average for between 10% to 12.5% of the total population who have mental health problems. Of course, we have a lot to understand when it comes to the granularity of the data, and we need more specific data for this. But of course, looking at this slide, this actually is very telling also of the prevalence of mental health in our communities. And this slide is actually a slide that talks about the prevalence of mental health conditions in Southeast Asia from 1990 to 2017. And as you can see, Singapore, Malaysia, Laos, as well as Thailand actually are the countries with highest prevalence of mental health and substance abuse disorders, while Vietnam, Myanmar, Indonesia, as well as Southeast and the Philippines actually are the top 4 lowest countries with the lowest prevalence of mental health problems. And this slide is actually looking at the prevalence of depressive disorders according to age and sex. And as you can see, across all ages, prevalence of mental health problems in women are actually more common. And there might be a lot of possible explanations for this one. Some would say that women are more open about seeking help. That's why they get referred to mental health services and they get added to the data. But of course, what I want you to understand from this slide is that when we talk about mental health statistics, or even how to approach the programs in terms of mental health, we have to factor in the gendered perspective also, because the experiences of women might be different from the experiences of men when we talk about mental health, when we talk about how they cope with the stressors. So it's very important that we have discussions on gender when we talk about mental health. So that's also one factor that can influence the mental health of a certain situation or of a community. And in the time of COVID, we can actually expect that these numbers might actually increase. No? So right now, we don't have specific data in terms of how many people in Southeast Asia are actually affected by COVID. But well, we have numbers for COVID, but we don't have numbers for people with mental health conditions in the time of COVID. So we need more data with regard to this one. But right now, we're actually seeing a lot of mental health concerns. So one factor is uncertainty about the future. So we don't know when the pandemic will end. We don't know when the lockdowns will stop. We don't know when classes or workplaces will resume operating. So those definitely can have a negative impact in terms of our mental health. And of course, with the changes that are happening, online schooling, remote work, as well as work from home arrangements can also influence the way we actually live. And sometimes it can actually blur the lines between work and rest. And that can actually place a very big toll in terms of our workers. And of course, with the isolation happening right now, we might actually experience heightened emotions because of pandemic. So we might be experiencing some form of distress, sadness, anger, frustration. Those are expected reactions in a time of pandemic. And right now, there might also be some barriers in terms of accessing certain services. So I know of people who are having problems in terms of accessing services of psychiatrists or psychologists because the clinics are closed down right now. I know some people who are not continuing their medications because the supply is not very well established, and they might have problems in terms of accessing medications. So these are just some of the concerns that might arise because of the COVID-19 situation. And on top of all of this, we can actually see that there might be some feelings of isolation and even loneliness as we implement community quarantines and various lockdowns. And what I'm saying here is that anyone is actually vulnerable in terms of developing some form of mental health concerns. So no one is actually exempted from developing some form of mental distress. So they might not be clinical disorders, but they might be negative emotions that we actually experience right now. And of course, we can't talk about mental health without talking about stigma. And of course, sometimes we have to understand that stigma is actually a cycle. So if stigma is still very high in a certain community, people might not be open about their mental health concerns. No? They might not actually access certain services. And when they do not receive adequate support and treatment, they can actually experience more severe forms of mental health problems. And that can compound on the stigma that they actually experience, especially if they misbehave in a certain community or they become violent in a certain situation. So it's very important that we address stigma. And of course, these are just some of the negative misconceptions about mental health. And I think this actually stemmed up from the fact that psychiatry and the psychology actually came from a very dark past. And this is something that we need to understand, especially if we're going to talk about addressing the imbalances or the inequities in terms of mental health conditions. So just to give you a quick rundown regarding the psychiatry's dark past, in ancient times, they practiced what we call trepanning. So before, in the ancient times, they believed that mental health problems are caused by evil spirits. So if you're possessed by an evil spirit, then one of the interventions that they do is what we call trepanning. So what they do there is that they try to burr a hole in the skull of a person so that the evil spirit will come out of the head of a person, thereby curing the mental health problem. So as you can see, those are very archaic and medieval ways in terms of curing mental health conditions. And of course, before there were also theories that mental health problems are caused by imbalances of the different fluids in our body. So one of the interventions that they do before is that they let the person bleed. They say that it actually cured mental health problems. But of course, we all know now that letting a person bleed might actually do more harm than good. So it's important that we also keep that in mind. And in the medieval times, they talked about mental health problems are caused by demonic possessions. That's why they tried to kill the witches because they were the ones who were channeling these kinds of demonic possessions. And in the Renaissance times, we saw the presence of asylums, which are actually sources of human rights violations and other forms of abuses. And even in the modern times, there are a lot of debates with regard to the role of medications, with psychosurgery. So if you're familiar with neurosurgery, where they remove a certain part of your brain, like for example, if you have a tumor in your brain, they remove a certain part of your brain so that it becomes cured. So in psychosurgery, what they do is that they try to remove a certain part of your brain so that the manifestations of mental health problems will be cured. So as you can see, this actually led to a lot of debilitating problems when it comes to their physical health also. And of course, there are a lot of questionable therapies, like for example, extraconvulsive therapy, as well as insulin shock therapy that have been removed from the array of mental health interventions that we do right now. And we also saw how mental health was weaponized against certain groups of people. So in 1934, we actually saw how the Nazi regime used mental health as a reason for them to remove or kill people who do not belong in what they call the Aryan race. So for people who belong to the Nazis, they actually supported them. They provided psychotherapy. But for those who are not included in their race, they actually sterilized them. So especially for those who are actually experiencing schizophrenia, bipolar, and even alcoholism. So as you can see here, there's actually a big imbalance in terms of the treatment that they provide to specific groups. And in the USSR, we can actually see also how they use mental health as a way to detain people who do not share the same beliefs as them. So we're talking about political beliefs here. So for people who are not believed to be supportive of the government, they actually termed the diagnosis called sluggish schizophrenia. So this is a type of diagnosis where they said that even if you don't have mental health manifestations right now or any change in behavior, you should still be detained because later on you will be a threat to society. So as you can see here, it was very rampant during the time of USSR. And of course, there are a lot of people who actually condemned this act by USSR. That's why in 1970s, in the late 1970s to early 1980s, they actually formed what we call the Working Commission to investigate the use of psychiatry for political purposes as a way to push back those people who are weaponizing mental health for political reasons. So this is the advent where people become more critical about the government also. And there was a time also where the members or the psychiatrists who enabled the government in terms of doing political persecution were removed from the World Psychiatric Association. So they were left out by the Global Association of Psychiatrists. And of course, there are also a lot of concerns with regard to how we diagnose people with mental health concerns. And until now, I think there are a lot of debates how we differentiate normal reaction to mental health conditions. And if you would look at the history of the DSM, or the Diagnostic Statistical Manual, so this is a guide that we clinicians use to diagnose people with mental health concerns. And it actually started from a very simple survey conducted by psychiatrists. And it was filled out by the members of the American Psychiatric Association, where they sent out the different, where they sent via mail the different clinical disorders that they think should be included in the DSM. So in 1994, which was the 4th edition of the DSM, we have around 374 different mental health conditions tallied in the DSM. So as you can see, it's very arbitrary how they first identified people with mental health concerns. And then, of course, this was questioned by some psychologists and psychiatrists. And one of the most famous experiments there, or challenges to that kind of way of diagnosing people, is what we call the Rosenham experiment, which was conducted in 1972. So what Rosenham did, he was a clinical psychologist during that time. He tried to actually instruct 8 people to pretend that they have auditory hallucinations, meaning they're hearing some words or some speech that other people can't hear. So what he did is that he instructed them to pretend, and then he instructed them to go to the asylum to have them checked. And of course, they were admitted because they were displaying manifestations. And what Rosenham also did is that he instructed them to abandon all of the symptoms once they're inside the asylum. So once they're inside the treatment facility, they will be magically cured of the mental health condition. So they won't hear any auditory hallucinations. And what happened there is that, of course, they were not allowed to go out unless they admitted that they have a mental health condition, and then that they would continue following up in their community, in that specific facility. So what they did, of course, when the psychiatrists and the psychologists knew about Rosenham's experiment, they challenged Rosenham again to send in patients in their facility. And they said that they would be able to identify who does have a mental health problem and who is actually pretending to have a mental health concern. So out of the next 193 patients that they saw in that facility, 41 were turned away because they thought that they were imposters, and 42 were actually admitted, but they were monitored because they were suspected to be imposters also. But interestingly, it seemed that Rosenham did not send any patient during that time. So as you can see, there are a lot of gaps in terms of how we diagnose people with mental health conditions in the early stages of the discussion on mental health and psychiatry. And of course, inside the asylums, there are a lot of accounts that documented the human rights conditions. So, of course, one of the pioneering work there was done by an American journalist named Nellie Bly, who wrote 10 Days in a Madhouse. So she documented the different human rights violations that are happening in a women's lunatic asylum. And right now, this is the current version of the DSM. So right now, it's more scientifically grounded and more biologically based. But of course, there are a lot of concerns with regard to the over-pathologization of mental health issues. So meaning, there are a lot of disorders that are being challenged by some people that might be considered as normal reactions, but are now classified as diagnosable mental health conditions. And of course, there are a lot of issues or controversies with regard to the financial ties of the creators of those who formulated the DSM to pharmaceutical companies. So we also need to understand that the pharmaceutical companies can also be potent lobbyists for mental health conditions. Of course, if a lot of people have mental health problems, then definitely the demand for medications will be higher, and that's good business for the pharmaceutical industry. That's why in one article they said that the pharma industries are actually the engines of diagnosis. So one important concept that we also need to understand. Of course, there might be specific groups of people that might be needing mental health medications, but it might not be applicable for everyone. So we have to be rational in terms of using medications. And there was also this article in New York Times where they said that sometimes the way psychiatry is being practiced right now is also shifting. So before, they used to do a lot of psychotherapy, meaning talk therapy and counseling, but right now they shortcut the treatment to plainly giving medications. And I think that's very questionable, especially if we're going to talk about holistic understanding of mental health. And because of this one, there was a movement called the anti-psychiatry movement, which called out the politicization of psychiatry, the inhumane conditions in the asylums, and pushed for the holistic understanding of mental illness as well as mental wellness, and as well as promoting human rights as a framework for understanding mental health conditions. And of course, there are a lot of theorists with regard to this one. But I just like to emphasize that most of the debates are actually centered on the causation of mental health problems. So some would say that it's partly social and economical, while some would say that it's actually biologically based. Of course, if we're going to say that it's biologically based, then definitely the social conditions will not actually influence the mental health of a person. But right now, later on, I'll be presenting to you the current understanding of mental health. And of course, before, you also know that homosexuality was also considered as a mental health condition. But right now, it was already removed from the Diagnostic Statistical Manual. So even in as early as 1973, the United States actually declassified homosexuality as a mental health disorder. And then later on, as early as 1997, China decriminalizes homosexuality. And then there are a lot of discussions already regarding the use of conversion therapy to cure people who do not belong in the usual sexual orientation, gender identity, and expression. And one of the critiques also that arose from this is what we call psychocentrism. So this means that this is actually the critique posed on the idea that mental health conditions are purely based on the biological model. So the idea here is that we have to have a holistic understanding about mental health that includes historical context, that includes social ills that we experience right now, as well as economic issues that might be affecting our mental health. So this is actually the critiques of psychocentrism, that we have to shift our understanding with regard to that. So right now, I'll be focusing on talking about how do we actually promote a mental health framework that is centered on social justice. And if you would look at the definition of the World Health Organization right now, it's actually reflective also of the changes that we've seen in the past few years. So as you can see, from an illness perspective, from talking about mental health as equated to mental health conditions, we're now looking at mental health as a state of well-being. And as you can see here, the definition is actually very broad, that it actually includes the idea that stressors or negative life events are actually normal occurrences in our day-to-day lives. And as long as we're able to cope and continue to function and continue to find meaning in our everyday lives, then we can be considered mentally well. And as you can see from the last slide, it actually talks about giving a positive contribution in your own community. So as you can see, there are the definition right now is actually more comprehensive compared to the very fragmented view before. And as you can see here, this is the biopsychosocial model of health. We're now looking at the different factors that influence mental health as interrelated to each other. So meaning the biological, something that is very external to you, your genes, your the chemicals in your brain called neurotransmitters, and even your physical health can also influence your mental health. So it's interrelated to your psychological factors as well as social factors. And in the time of pandemic, I would argue that most of the stressors that we experience now are caused by social factors. So it's important that we also have social interventions for social illnesses that we face right now. And that's actually the same reason why we advocate for social justice in terms of mental health. And of course, we have to understand that not everyone actually lands the same. So we might be experiencing this COVID situation the same way, but the level of us being affected, especially if we come from marginalized groups or sectors, it might actually affect us at a more substantial way. So for example, if you're coming from LGBT, from poor families, from people in urban poor areas, so definitely the impact is higher compared to people who are living comfortable lives right now in the time of pandemic. And this model is actually one interesting concept also. It's called the intersectional theory. So this theory tells us that we as individuals have or embrace different identities. So for example, we can actually be, for example, for me, I can be Filipino, and at the same time, I can also be male. So these identities can be sources of privilege as well as oppression. So for example, if you're poor and at the same time you're coming from the LGBT community, then you might be experiencing higher rates of oppression compared to me, who is a heterosexual male and from the middle class, for example. So we have to understand these kinds of intersectionality so that we can also correct the systemic injustices and violence that these people experience. And this model, the social ecological model, tells us the influence of our external environment to our individual mental health. But what's interesting also about the social ecological model is that the way we actually behave as individuals also shape the wellness of the whole community. So it's a two-way process. The environment influences us, and we also influence the environment that we're in. And this is lifted from the Lancet Commission on Global Mental Health. And I know you're very much familiar with this. These are the 27 Sustainable Development Goals. And as you can see, these are actually very much interlinked. And as you can see, the goals that are set are actually also things that we actually experience on ground. So for example, if we're going to talk about climate, for example, definitely that will have an impact in terms of us, in terms of how we perceive it through natural disasters, and that might actually increase the levels of trauma as well as violence that we experience in our own circles. So what I'm trying to say here is that the very systemic issues are also linked with our very personal and individualized experiences. And when we talk about justice, and I said that the focus of the discussion is more of social justice and mental health. It's actually talking about removing the causes of inequity as well as inequality. So instead of you providing support for people, as seen in the slide when we talk about equity, we actually remove the structural barriers that allow people to have equal rights, equal opportunity, as well as equal treatment. And of course, these are the different transformational shifts that we're seeing in terms of global mental health. But I'd like to emphasize the first one, which is the evolving nature of mental health disorders as well as intervention. So right now, we're looking at it at a more comprehensive manner, similar to how we discussed the biopsychosocial model of health. And for the last part of the discussion, I'd like to zero in on how we can actually concretize the intersectionality of social justice and mental health. So the first tip that I would like to share with you is that when we talk about intersectionality, there has to be some form of intentionality as well. So we have to, for example, when we're talking about mental health, we have to understand that we might need to use different lenses in terms of making sure that the special needs of certain sectors are actually addressed. So for example, if we're going to talk about abuse of women which is actually very high right now in the Philippines, we might need to also include feminist counselors and feminist thought in terms of providing support to the victims of violence and other forms of abuses. The second tip is that I think we also need to rethink how mental health is being addressed. So, of course, right now we have a lot of interventions happening. We have civil society organizations stepping up their game, providing services, and we're also establishing several referral mechanisms for people with mental health concerns. But I think it's important that we also make sure that our policies and programs are also comprehensive, and at the same time, it also addresses the whole spectrum of people with mental health concerns, not only those who have diagnosable mental health conditions, but also those who are well. Because definitely, wherever you are in the wellness or illness continuum, you need some form of support. And then third, we have to have safeguards. We have to talk about the concept of over-pathologizing normal reactions, because at this point in time where we are actually experiencing a lot of stressors, we might be having some form of negative feelings. And that might be misinterpreted by some as a mental health condition already. But of course, at this point in time, we have to recognize that not all negative emotions equate to mental health problems. And of course, if there are oversteps in terms of human rights right now, we need to also address them, especially if it's occurring in psychiatric facilities or asylums, if there are still asylums in other parts of the country. And then fourth, we have to instill some form of political consciousness among advocates. Because if you would look at the history of mental health, how it's actually framed before, and how we still continue to fight for it now, we have to really have a holistic understanding of the different factors that might affect mental health. We can't just talk about mental health from the lens of a healthcare professional, because that won't be enough, especially if the triggers or the ones causing mental health disturbances are social in nature as well as structural in nature. So we have to have some form of deeper understanding about social ills and how they actually intersect with mental health. And then fifth, and I think this is the last slide, we have to validate the normal reactions of people to systemic injustices and imbalances, because we have to shift from blaming the individual, because I think that's also the reason why stigma happens, because we blame people for being weak because they developed their mental health concerns, to recognizing that there might be some things that are outside of the control of a person that might be affecting their mental health condition. So I think this is the last slide. And if you have some questions, you can reach me via email. So you can email me at rjnagitmd@gmail.com, or you can also follow me on Twitter or Instagram at Raymond Naguit. So right now, we can actually proceed with the question and answer portion of the discussion.
All right. Okay. All right. We have came to the end of the slides presentation by Dr. Naguit. And for those that are following us right from the beginning until now, I can see your reactions. I can see the total number that is viewing us across possibly 10 different watch parties right now. And I just want to give a shout out to some of our viewers that has been following us. Nasim, President Nasim, good to see you here. Kimberly, Mark. Thor from Myanmar, all the way from Myanmar, welcome. Ella from Philippines. Ken from Philippines, yes, we can see you, Ken. Ellie, treat people with kindness. Definitely. And the stigma. Jarek, watching from Zamboanga. Rachel Collin, watching from Manila.
Some of them are our members. So
It's good. There is no such thing as having too much passion for the cause. We definitely need more people jumping in. And I can see a lot of you are following us. You have been spamming me different questions on the messenger. All right. Okay, so once again, if you are watching this, although you do miss out the earlier presentation, do know that you can always watch the replay. And it's very common for all our live stream session that the replays sometimes double the views. So you can always save this link and watch this later. But if you are free right now, what you can do, viewers at home, at work, at your dinner place, you can start a wash party to share it with your friends and family. And if you have a question on mental health, on social justice, on advocacy, right here we have Dr. Raymond John Naguit, an experienced mental health advocate that's been working on many different approaches and many different areas to bring mental wellness to the forefront. So do not miss this opportunity to ask your question. All right, Dr. Naguit, are you ready for the first question from the floor?
Yes, go ahead.
All right, the question is, Dr. Naguit, just now you have gone through some history of psychiatry and how reforms are being made, progress are being made. So the question for you is, in your opinion, what is the biggest break in history that changed the way mental health is perceived in society? What do you say, Dr. Naguit?
I don't think that there's a specific moment that actually catalyzed the change in terms of mental health. So it's more of a lot of specific change or reforms that were actually instituted for a very long time. So I think one of the game changes there is the discovery of the biological model of mental health, which actually looked at the different biological basis of mental health. So right now it's actually still evolving. That's why we're still trying to look for a lot of interventions that are related to medications. But at the same time, right now there are a lot of discussions already regarding the shift. Earlier I was mentioning about the 4 transformational shifts that are advocated for by the Lancet Commission on Global Mental Health Report. And probably one of the most striking for me there is the shift from the professionals to the communities. So we've always been very active in terms of advocating for community-based mental health. And we have to recognize that not all mental health interventions should be done by professionals. And this is actually also in line with the WHO service delivery pyramid, which actually categorizes the different mental health interventions. And if you would look at the base of that pyramid, it actually talks about self-care as well as informal community-based care. So that's also an indicator that we need to talk about mental health more and how to implement it at the community level. Because I think, of course, it's less costly, and at the same time, we want people with mental health conditions to be resilient. So I think those shifts are actually very interesting right now.
Indeed. And I would like to concur with you, Dr. Naguit, because people has been treating mental health as if it is a different kind of health. But if we take care of the body, definitely we need to take care of the mind. And it should not be discriminated, and it should not be seen differently. You know, I look forward to the day when people can look at mental health as if it is a fever, it's a cough, it's a flu, and it need to be treated. Sometimes we need expert help, but most of the time we need the people around us to give us the support. And I would like to read out a few of the comments, from, following you, sir, Jarek said, and Amina says that great sharing, learning a lot from you. I'm inspired. Domini says, hi, Dr. Rish. Thank you again for the insightful presentation. Can say, well presented. The history of mental health is interesting. Indeed, not many speakers that we have, started from the history of mental health, so that people can see, how much work and how many decades they have took for us to reach today. And progress have been made. If progress have been made before, we can surely make more progress in the coming years. If anything, I think this is a motivation for us to keep pushing for the cause. Okay, with this. The second question is, since Dr. Naguit, you have been talking a lot about activism. So the question from Philippines is, how vital is activism in pushing for social reforms? What are your advice to young activists when they feel like giving up and when they feel scared for being vocal? This is very true, 2 questions here. Yeah. Is activism effective? Secondly, people are being threatened or they are fearful of actually speaking up. So how would you deal with that, Dr. Naguit?
I think if you would look at the history of mental health, when I discuss the psychiatry and the history of psychology, there are a lot of ways on how activism was seen there. If you would look at how the homosexuality was declassified as a disorder, it was a result of activism. So it was removed because of a meeting conducted by the American Psychological Association, who were then crafting the DSM, and then they were stormed by LGBT activists. So because of that, it was declassified and removed as a mental health condition. And even right now, especially when we started the Youth for Mental Health Coalition, it was an act of activism to actually start talking about it, to lobby for a law that was basically not seen as important before. So challenging the status quo, and regardless of how aggressive or how passive it may be, are also forms of activism that we need to also recognize. So, and sometimes even just plainly talking about it is also a form of activism already, because you're already changing the minds of people, especially if it comes from people with mental concerns who are forwarding their narratives. And I think that's very brave. I've seen a lot of, and I've worked with some of them in the Philippines, and it's actually very inspiring, or also how they take ownership of their concerns, as well as continue to extend the helping hand to fellow activists or fellow people who have been experiencing some form of mental health concerns. So I think that's very inspiring for me. And probably someone also asked about how do we make sure that activism is sustainable? Because I know activism is a lot of work, and I'm not immune to that also. I've experienced some form of burnout also in the past few years while advocating for mental health. So it's also a question for us as an activist and as a mental health advocate to also make sure that we are accountable to the things that we say. Because we can always talk about self-care, we can always talk about minding our own mental health. But of course, the bigger challenge really in terms of mental health advocacy is really walking the talk and making sure that we are accountable to the things that we say.
All right. I think that's a fine answer from Dr. Naguit. I think the question of whether activism makes a difference is sometimes, people has been working so hard in their causes, and then they just don't see the light, anytime soon, and they feel a bit disheartened. And always remember this quote by Mother Teresa, whether you are for or against, or what she stands for. But she has a nice quote, right? So Mother Teresa says this, that she say, we ourselves sometimes feel that what we are doing is just a drop in the ocean. That's what activists feels like most of the time. But the ocean would be a lot less because of that drop. So don't give up.
And I know, especially when we talk about activism, some of the goals that we set and some of the visions that we cast are not necessarily easily seen. So it's not like a project that you deliver you implement the project and then you see the outcomes already. So it's a very long shot. That's why one of the tips that I give to young activists is to also be conscious of mapping out your small wins. Basically, smelling the roses as you continue the fight for social justice, for example.
True enough, celebrate every wins, however small it is. And right, so the next question is from Malaysia. Okay, the question is, what inspired you, Dr. Naguit, to start your advocacy work? What is the first cause that you championed? And how did you proceed? Yes. What would you say, Dr. Naguit?
Earlier, before the live stream started, Hugo already asked me that question. And I said that when we talk about advocacy work, I always see it as an external expression of personal pains as well as inconveniences. So most of the advocacy that we are pushing for are also manifestations of what we experienced in the past. And for me, in terms of mental health, it has always been my experience when I heard someone or I had someone who attempted suicide as well as someone who died by suicide in our own organization. So that actually allowed me to really reflect on my activism for mental health, as well as it also provides me some sense of mission, because right now we can't actually tell who's actually experiencing some form of mental health problem. And we might be having people in our own circles, our friends, our family members, who might be experiencing some form of distress. And that's why I always would like to really emphasize the role of communities, because they are actually the first line of defense in terms of preventing people from dying because of suicide. And of course, there are a lot of stories that needs to be told in terms of mental health. That's why it's important that we also hear those kinds of stories from them.
Mm-hmm. True enough. And I think we are receiving a lot of questions in terms of advocacy. People are interested to know, how to be an advocate. So how about we pick this question? This question is from Indonesia. So the question is, right now I'm a working professional. So I'm, quite stuck in my 9 to 5. How do you still find time for advocacy? How do you balance the time? How do you find the drive to do so? Do you have some practical tips on how to be an advocate?
Yeah, that was actually also my struggle when I was still working inside the hospital, because our duties are actually 24 hours or even 12 hours. And the shift is actually different. So sometimes we work at night, sometimes we work in the morning. But I think you always fall back to something that you are actually very passionate about. So you make time for it. For me, if I have free time, like for example in the weekends or when it's my time off, for example, that's where I insert advocacy work. And probably this is where the importance of you working with other people come in. Because definitely when you're working on an advocacy that's very big, it's important that you have a team behind you. And I think that's one of the secrets in terms of how we manage to continue the advocacy on mental health, because I have a team behind me and I work with a lot of organizations. So it's important to delegate also, and also make sure that you also empower people as you continue your advocacy.
It's true. Teamwork makes the dreams work. So,
yeah.
Yep. We are never alone. There are a lot more like-minded people like us out there that are willing to champion for the cause. It's a question of working together and making it happen. So I would like to take on a question by Ken. So for the viewers that is watching this right now, we are kind of warming up a bit. We don't want to give all the critical questions one shot. We'll give you a warm up and then we go to high and then we cool down a bit and we come to the next high. So right now, I would like to take this question from Ken. Ken, if you're watching this, right, say hi. Would you consider the advocacy on mental health as a form of activism? And which specific points in advocacy for mental health can we consider it to be a form of activism? All right. So this is a very technical question. What is advocacy? What is activism? Dr. Naguit.
For me, one of course, you can always advocate for something. But when we talk about activism work, it's always about changing the structures that are not in the status quo. So, of course, you can always advocate for example, accessibility of mental health services. But we also need to have or develop that kind of critical perspective in terms of looking at what is the best way to address these kinds of concerns. Like, for example, we can always talk about providing medications to people. We can always lobby for accessibility of medications. But if we do not appraise or we do not challenge the role of medications and the role of big pharma, for example, then we're just maintaining the status quo. So probably in terms of activism work, we have to understand the bigger issues surrounding mental health. And we also need to map out what are the intersectionalities of mental health. Like, for example, how does it intersect with gender? How does it intersect with labor relations, for example? So those are very important concepts when you talk about the activism side of mental health.
Very true. I think the point of intersectionality if there is one takeaway from the live stream and sharing from Dr. Naguit tonight, this would be it, right? To look at it from multiple angles, to find stakeholders, to find people that can join us, to make this reform for mental health. Now, as we are talking about reform, now let's take this question. This question, yes, indeed, we talked a bit about the Malaysian law on mental health earlier before we began. But right now, we would like to tackle something closer to home. Another question from Philippines. How did you feel about passing the mental health law in the Philippines? Right, we are all aware of it. So what do you say, Dr. Naguit?
Well, we viewed it as a victory, definitely. So after 20 years of waiting for a mental health law in the Philippines, we're very ecstatic when we actually found that it passed in Congress during that time. But of course, I think in the Philippines, one of the challenges that we also face is that there's actually a gap between passing a law as well as implementing it. So I think it's not just related to the Philippines, but also in other parts of the world, that there's a gap between the passing of a law and its implementation. So right now, we're still trying to strive for improved or increased implementation. And of course, that includes also lobbying for adequate budget to fund mental health, because the law is actually very comprehensive already. Of course, there are still some gaps when it comes to the provisions in the law, but it's very comprehensive. It's very rights-based. It talks about the shift to community-based care. It talks about providing infrastructure. It talks about having leadership and governance frameworks. But again, if it doesn't have any budget, or it doesn't have any political backing, especially in the Philippines where health is devolved, so meaning the different cities might have different ways in terms of how they prioritize as well as implement their own mental health program. So I think the challenge now really is, how do we make sure that it's actually localized in the community as well as in schools and workplaces?
Very true. The localization, the attending to the needs, because like what you have mentioned, different demographics could have different needs, right? That's why it needs to have localized content. Okay. So yeah, I just want to read out this one comment, right, from Ella. Oh yeah, it's your question. So, it is okay if the only thing you achieve this year is to survive. Indeed, 2020 is quite a year. And if you are still here, we should have some gratitude that we are still alive and kicking. So the next question is, to follow up on the law, as a Filipino, do you think that the Philippines is a safe space for people struggling with mental problems? What do you say?
That's a very difficult of course, I think if we're to talk about the safe space, it's the safe space is actually defined by the person who is experiencing it, but it's largely shaped by the environment that they're in. So again, we can talk about safe space internally, but of course there are things that that can make sure that the environment is also mentally or psychologically safe as well for the person. So I think we're still working on that. Of course, social stigma is still very high. Not everyone would be open about telling that they have a mental health concern. And it's also partly because of the culture of the Philippines. We have what we call, if you would look at the indigenous Filipino psychology, there's a concept called hiya, or it's translated to shyness. So not everyone, especially if they have family member who was diagnosed with a mental problem, they won't openly share it to another person. So those are just manifestations of the lack of a safe space for people, and even for young people. So not all young people would be open up about sharing their mental challenges to their parents. So those are actually very important concerns that I think we have to really work hard to address.
That's very true, like what you say, right? Sometimes it depends which type of help that people are open to. Sometimes they might not be open to their families, but they're more open to their peers. That's why we have peer counselors. Sometimes they don't feel comfortable talking to someone, that is so close to them as their friends. Perhaps they would like to speak to an expert, confidentially. You know, we need channels, establish multiple options for people to channel their thoughts.
Somehow related to the importance of psychological or psychiatric support. Sometimes we can also define safety as the ability or the feeling that you would be given support just in case you need mental health services. And right now in the Philippines, accessibility is still one big problem. Mental health services are generally expensive, and usually, if you would look at the distribution of psychiatrists here in the Philippines, they're usually centered in urban areas, and most of them work in private hospitals. So cost can be a very big challenge. Medication is also very expensive. And of course, when we're talking about mental health, it's not just about taking 1 week of medications, but some of them usually do take around months before they can actually be weaned off of these medications. So we can also define safe space with regard to accessibility, which is still a challenge for Filipinos.
Very true. The challenge of accessibility. Yes. Oh, okay. Now we are coming back to the relationship question. You know, in every mental health workshop, somehow people will come back to the relationship question. So the question of, in an abusive relationship where you are stuck in quarantine with the abuser, what steps do you recommend to keep sane? This is from the representative from Model United Nations. So Dr. Naguit, the question is on being in an abusive relationship, but you are stuck in quarantine. So what steps should such a person take?
Well, for me, the first step really is to ensure that you're physically safe, because sometimes abuse can come in various forms. Sometimes it can be physical, they can hurt you physically, or it can be psychological, which I think even if it doesn't really threaten you immediately, it actually leaves very wide psychological wounds later on. So definitely the first, after ensuring that you're safe, I think one of the things that we need to consider is to recognize that we are in an abusive relationship. So that's one thing. So it's good that they already recognize that they are in an abusive relationship. But sometimes one of the things that I've seen in people inside those relationships is that ambivalence can be very high. So they're not sure if they want to be in that relationship or step out of it. So probably that's where the importance of community support comes in. So we have to understand that these kinds of or situations should not be handled by one person alone, because it's very difficult to get out, especially if you do not have perspectives coming from another person. So you might want to consider sharing this with a trusted friend or another person, and the family, if the family is one of the abusers also. So that's one. And of course, we have to understand that no one deserves to be abused. That's very clear. That's why we need to really be proactive in terms of reporting these kinds of abuses. And probably if it's very minimal, like for example, if it's psychological abuse, then probably you might need to also be proactive in terms of telling that person that what they're saying is not good. Definitely, we need to address whatever form of abuse, no matter how severe it is.
I think Dr. Naguit have summed it up. You got to acknowledge the situation. You got to set boundaries, and you got to seek support. All right.
Yeah.
So, I would like to read out some of the comments again. Sometimes we refuse to open up because of the stigma. Some are afraid not to be hurt. This is why they tend not to disclose their state. And most of the time, the help costs deter people from seeking help. Yeah, I think it kind of sums up most of the dialogue, revolving around mental health. It's a question of we fear what would other people think, therefore we don't say it out. And we want to get help, and then we realize, wow, this is so expensive. Okay, I will just toughen up myself, So it's back to back, It's a vicious cycle. Yeah, I like the stigma cycle slides that you have. Yes, that's
Actually,
very true.
I had an experience before where I had a patient who was very young. So he's a minor, and of course, if we're going to talk about mental health of minors, we need to ask parental consent for them to receive services. And unfortunately, the mother was not understanding about mental health or was not supportive of the child being given psychiatric support. That's why later on, when we talked to the child, I found out that the child actually saved up from his allowance just to seek professional support, and the mother was not very supportive. That's why we were not allowed to give services for that child because the mother did not understand. So as you can see, stigma and the lack of information can also influence the way people access services, as well as the affect the outcomes in terms of mental health for the child. So it actually came into mind when you were talking about economic inaccessibility.
Very true. How old must the child be until when he has his or her own autonomy to seek for help without parental permission? What age would it be in Philippines?
It depends. Well, in the Philippines, it's 18 years old. But
18 years old. Okay.
Yeah, looking at the experience of people in those who are accessing reproductive health services, so we have a separate law for that. They actually managed to lower it down by 15, if I'm not mistaken.
Oh, okay.
So probably that's something that we can also lobby for, especially now that we're in talks also with the different departments.
Very true, very true. I mean, it's never too young to ask for help. And you have highlighted the importance of education. Sometimes people are not educated on the matter. Therefore, they don't feel it is an important matter. They try to brush it off. Okay, just in time, I have a question on the education system. Okay, so if you are watching this, fellow viewer, your question is right here. In the context of the Philippines educational system, is it rightful to only maximize the effort to introduce mental health to students? Shouldn't the teachers, the educators, have to undergo similar mental health analysis and education?
Yeah. Actually, if you would look at
what are the efforts on the ground, to educate teachers right now?
Yeah. As the Youth for Mental Health Coalition, we were very specific on the part of the law where we wrote specifically mental health in schools. So right now, the schools are mandated to have their own mental health programs as well as policies. And right now, the Department of Health, I think, is crafting teacher trainings in terms of conducting mental health and bringing it to schools. Right now, there are a lot of conversations among guidance counselors because usually they are the first line in terms of providing mental health support to their to the students. And of course, I think right now in the time of pandemic, they're also very conscious about it. That's why there were pronouncements by the Department of Health to allot, once we reopen classes, the first few weeks will be allotted for mental health and psychosocial support. So that's something that is exciting. But of course, we're still waiting on how it will be implemented.
I think definitely some progress. We have been hearing a lot of progress, the passing of the law. And, when things are truly integrated into the schooling, into the education system, that's when, small progress can be made.
Yeah.
That's like small wins that we have here, step by step. And all right, here we go. Why is advocating? Of course, I understand the upcoming question could be sensitive to some of the viewers, but I urge you to have an open mind so that we can consider all perspectives, all angles, before we make a decision. Why is advocating for LGBTQ rights important in mental health advocacy? Why is it relevant? Dr. Naguit?
Of course, when we talk about sexual orientation, gender identity, and expression, so regardless of what your preference are, I think it's very basic that each person has the right to health. And that includes access to mental health services, recognizing that they have dignity just by being a person, regardless of what your sexual orientation is. So I know there are conflicting views about about the LGBT community. But if you would look at also the rates of LGBT community, the rates of people with mental health problems in the LGBT community, I've heard that it's actually 3 times higher compared to the general population. So of course we have to understand that for those who are highly affected by certain problems, then resources and support must be higher to them. So that's just making it equitable. And of course, there are a lot of concerns like discrimination. No one deserves to be discriminated because of what they believe in and what they choose. So I think more than providing access to mental health services, we have to really address the root cause, which is discrimination as well as stigma among these people. And that applies even to women, even to people who are underprivileged in terms of economic situation. So it doesn't just remain in the LGBT community.
I think that's a good answer, because a lot of people are very preoccupied with their views of what is right and wrong. And sometimes we pass judgment without knowing how much it has affected another human being. I think before we try to be right, we should first try to be human.
Yeah, or be kind.
Every human, being kind, like what Ella have said, right? First be kind, and to have a little bit more empathy for our fellow human beings. And I guess that's the root. That's the one of the prime qualities that a human should have, their kindness, empathy. Because without that quality, if we can discriminate against another human being, I don't quite think you would care that much about, say, the environment, the animals, or much less any other causes. Because for someone that is so similar to you, if we do not have the kindness, the empathy, the understanding, it just starts everything. The
and
source
that's also,
of all causes.
And that's also somehow related to how advocacy works. And I've always viewed advocacy as the constant process of you deepening your empathy towards another person. Because, of course, you also need that as fuel as an advocate to continue doing what you do. You have to be fueled by deep love for people, even if you don't necessarily share the same viewpoints as them. So I think that's one of the powerful takeaways I think that I learned in advocacy work, that sometimes we lobby for things, we fight for things that benefit sometimes even those who do not share the same beliefs as ours.
Wow, you did reminded me of this quote. I think it goes something like this. I may not agree with what you say, but I will defend to the death your rights to say it.
Yeah.
The rights for expression, and I think there is beauty in diversity in ideas that we can explore together. Well, we still have a couple more questions. Now that Dr. Naguit is with us, it's a good opportunity. If you have a question, viewers at home, those who have just after your dinner, we can still take a couple more questions. Just a little bit more, because Dr. Naguit is with us for over an hour. And the amount of reacts and that we are getting, the watch parties, we'd like to thank you for staying with us. All right, let me see. How about we take one from the main chat? Rachel Collins, what are the best ways to start a youth-led mental health organization? Well, as the chairperson, Youth for Mental Health Coalition, what do you say?
Well, I don't think that there's any best way in terms of starting organization, but I think it actually really starts with you having a common understanding about a certain situation, a common analysis, because that can be a very good rallying point in terms of mapping out where to intervene. And I know there are a lot of ways in terms of how to help in the mental health advocacy right now. Especially, I know some people that are focused on education. I know some people that are very specific for mental health for LGBT. I know people who are specific for addressing the gap between mental health and social media. So there are a lot of ways to to really enter the advocacy. And it's just a matter of you really reaching out to more people and mapping out who share similar beliefs as you do.
Very well. I hope that answers your question, Rachel. Okay, of course, we can take a question from Amina. Thank you for staying with us all the time, right from the beginning. So yeah, back to the question of consent, right? What can you say about requiring parental consents for minors to get help? Of course, we do realize that Dr. Naguit have mentioned, some of the age limit, for example, for reproductive health has been lower to maybe 16, 15 years old. But should there be a consent at all? What do you think, Dr. Naguit? If someone is in problem, do we still need consent, or should we have the right to interfere? What do you think?
Well, that's a very debatable topic.
Yes.
But I think for general idea where I position myself is that as long as the person is able to weigh the consequences between the risk of you taking, for example, therapy, for example, or not taking therapy, then you should be able to receive the right amount of support and treatment. So it doesn't really come with age. Probably it's more of how a person understands the consequences of their actions. And sometimes you also need to understand that the parental support might also be needed, especially if we're going to talk about sustaining medications or mapping out the economic costs of follow-up consultations. Definitely, a young person might not have the resources in terms of finances. That's why there's also some form of logic in terms of getting parental consent, but sometimes it also gets in the way, especially if the parents are very traditional and conservative. So I'm actually in the middle with regard to that. But again, my position is that as long as the person is able to weigh the benefits and risks, then they should be able to receive support.
Well, that's a good question and a good answer from Dr. Naguit. Okay, so perhaps the question from Ken, right? Dr. Naguit, what are your thoughts with regard to mental health advocates who personally struggle with their own state? I have a few friends who are in that situation. Any advice? I think it's the question of the helpers need help. How do we do with that? How do we deal with that, Dr. Naguit?
It's completely understandable, because even as mental health advocates, we're not immune to having mental health concerns. As I've said earlier, I experienced some form of burnout before. I've experienced some form of rumination at some extent. So these are actually also an idea that when we talk about mental health advocates, they're not superhumans. Of course, they can provide all of the support, but they will also have their own bad days. That's why, as mental health advocates, it's really important that we establish also our boundaries and also be transparent when we're not okay and when we're not able to provide the right amount of support that a person might be needing at a certain point in time, especially if they come to us. So probably it's also a matter of us being also deliberate with regard to how we take care of ourselves also, because there's a quote that I've remembered. They say that you can't pour from an empty cup. That's why it's important that you also take care of yourself before you reach out to other people. But of course, there's no dichotomy there. You can always provide support and at the same time take care of yourself.
I think we have a lot more questions, but they are mostly, revolving around the same issues that we have tackled. So hearing the progress being made in the Philippines, so representing Malaysia, I would like to have a question, for Dr. Naguit as well. As we have mentioned, right before our live stream on how we are working on the reform for our own Mental Health Act, which has been the same for decades. And as we know, one of the setbacks in the act is the criminalization of suicide, where as this couple of months, due to the lockdown, a lot of people's livelihood are being destroyed. And our firefighters and saviors department has been working around the clock to save people from killing themselves. However, in Malaysia, we actually have this act where if someone tried to kill themselves, not too far from my house in the same area, someone tried to jump off the building, he did not succeed. So right now he's being fined 3,000 ringgit and possibly have to face a jail term. So the question is, if we were to push for mental health act reform, just like how you are passing of the mental health law in Philippines, what are the key criteria that you believe have contributed to the success of the reform? Dr. Naguit?
Probably I'd just like to first give a comment regarding the law, because I think if you look at it, it's actually contradictory to itself, right? For example, if we recognize that people who are having suicidal thoughts do need help, then why are we penalizing them? Why are we jailing them? Because if we jail them, it might actually worsen the mental health of that person. I actually had the talk in the past few days regarding the mental health state of people deprived of liberty. And definitely there's a big impact in terms of their mental health, especially now that they're isolated from their family members and services are not very well in terms of mental health inside the correctional facility. So it's also a question of what are the priorities in a specific policy. So I think that's also a segue to the next question, where to really clarify what are the guideposts, what are the values that we want to communicate in that certain policy. And it has to be translated to specific strategies. So that's more of the formulating the policy. But I'd always like to emphasize on the importance of participation of the young people, as well as people who have lived experience of mental health concerns. Because we can always pat ourselves in the back and clap our hands if we have a very elaborate mental health system. But at the end of the day, it's always the people who receive the services who should be the best judge of a certain service. That's why I always would like to advocate for participation of different groups in terms of formulating policies. And we've been very active in terms of conducting consultations outside of the government consultations, because sometimes the government might have limited access to advocacy groups as well as support groups. So these are groups that we have active conversations with. And one of the, I think, key reasons why it was successful is that we also talked with various sectors. So we talked with the LGBT groups, who has been one of the biggest supporters of the mental health movement, primarily because we share similar struggles in terms of stigma and discrimination. We also talked to people from the academe, because in the prior to the passage of the law, it was always been the mental health professionals who are at the forefront. But when we actually widened the sectors who are actively campaigning for it, then it actually put pressure on the government to really recognize the urgency of the law. And of course, we also need to make sure that people are educated about it, because of course people won't support something that they do not understand. So part of the advocacy work is really educating people about mental health, clarifying misconceptions, because of course I think one of the issues really when we talk about mental health is correcting the power imbalances.
All right, thank you for your insights. I think that's the beauty when Southeast Asia comes together, when we started our organization. Because as we say, we have a common history, we have a common culture, and there is sometimes people feel that their challenges are unique, but we'll be surprised. We have similar people across the region that are facing similar challenges. And we can learn so much from the wins and losses of our friends around the region. Together we can study the best practices and the best way to deal with mental wellness. So I think we have reached the end, right on time, on 9 p.m. Philippines time, our session with Dr. Raymond John Naguit. So for the final words, what are your aspirations for the mental health movement? You have started Youth for Mental Health Coalition. You have done a lot of speaking engagements. But where do you see this movement will bring your people to in the coming years?
Of course, I've
Mhm.
always valued the participation of the community, and I hope that people with mental health conditions do really have a very big influence in terms of how policies and programs are being shaped. So, because as I've said earlier, the power dynamics have to be changed for us to really make sure that the policies and programs are also appropriate to the people who receive mental health support. So, I would really push for that, as well as correcting the stigma that is actually affecting the accessibility as well as the acceptability of people with mental health conditions. And I hope that the youth won't get tired in terms of speaking up, in terms of questioning the norms in terms of mental health, because there is a lot to unpack with regard to mental health. And hopefully, we make sure that we conduct solidarity activities with other sectors that might be on the at-risk populations when we talk about mental health.
All right. With this, I would like to end it with some of the feedback from the audience. Thank you so much, Dr. Naguit. Thank you, sir. You have always inspired the youth to push for social reform. Dr. Naguit, your sharing has been very insightful, educational, and impactful. Dr. Naguit, your sharing tonight has inspired me to start being more active in my advocacy. Indeed. Dr. Naguit, thank you for joining us this evening.
Thank you.
It has been inspirational. Yes to social reforms, yes to mental health. I think there is this saying where they say, because our topic today from the slides is social justice and mental health. Although I can see many of you are championing different causes, but as the wise says, right, injustice anyway is a threat to justice everywhere. You know, and tonight, this evening, once again, thank you to Dr. Naguit. I hope this is the beginning of more to come from you and from all of you, our fellow audience. Let's work together for a better tomorrow, for a better community. Thank you, Dr. Naguit. Take care and good night, everyone.
And thank you to everyone who watched via Facebook. Good night.
Thank you. Good night.